today we have a different kind of stakeholder groups sharing their views about One Health and contributing to the overall discussions on how One Health can help us to make an impact on the ground and change the lives of many people for the better. So today I have the great pleasure to introduce representative of 3 funding agencies that have a distinct interest in One Health projects and in one way or another are involved in some of the activities we do through the HEAL project with the VSF Switzerland, with the CCM in Italy, and also at ILRI. So I'll give you a brief introduction to each of the people who we will have hear more of today. So we have Lensse Gobu, who is the Program Officer for Health at the Swiss Agency for Development and Cooperation in Ethiopia. Then we also have Larissa Meier, the Deputy Head of International Cooperation at SDC in Ethiopia. And so SDC is the key funding agency for the HEAL project. And then we have from the Italian Agency for Development and Cooperation, Faben Getachew, who's a nutrition and gender expert at AICS. And we have Gabriele Mugnai, who's also joined us today for this discussion. So AICS is funding a sister project of the HEAL project, so actually contributing to the same idea of what we try to achieve with HEAL. And then I also have the pleasure to introduce Björn Niere from the German Federal Ministry for Economic Cooperation and Development, BMZ. So BMZ is the funder behind the One Health Center at ILRI, and this webinars here, this HEAL, this community of practice, bringing together practitioners in One Health, is a joint initiative of HEAL and ORECA. So it's a welcome to all of you. It's a pleasure to have you here, and we look forward to hear from you. So maybe let's have a quick look at the agenda. So we first going to hear from SDC about their perception of One Health and ongoing activities in One Health and how One Health has become important for SDC. Then we're going to hear from AICS and then from BMZ. And then we can follow up maybe in more detail through a question and answer session in the format of a panel discussion. So here I then would remind people to use the chat function. So with that, I would like to pass over to Lensse to give the views and insights from SDC.
Okay, thank you very much, Barbara, for the introduction. I will try to share the screen. Kindly give me a few minutes.
Yes, that's great. We can see it. Please go ahead.
Okay. Yes, so as Barbara has already mentioned, I will point major points for One Health and Switzerland's engagement in the Horn of Africa region, and my colleague Larissa will complement at the end. These are the points that I will try to cover, starting from the strategic framework, seeing where One Health fits in, and the rationale of our investment, and finally, we'll say something on our ongoing One Health projects. Starting from the strategic framework for our health program, we are guided by the strategies which are listed on the slide. We have the Agenda 2030 and recently launched the new strategy for the international cooperation, which starts in 2021 for the coming 4 years. In that strategy, I don't want to go through every bullet point, but these are the areas which we map out in the health sector. So looking at the relevant areas in One Health, we work on health and well-being for all at all states. There is also something with regards to saving lives. As you know, there are emerging pandemic threats, and this is the rationale on why we engage on that. There is also the multi-sectoral approach and the multilateral, we also have multilateral engagement. So these are the areas in the bullet point where the health interventions of Switzerland fit in terms of the recently launched strategy. We also have the Swiss health foreign policy with 6 priority areas. The health security agenda is one of the priority areas, which fits into especially the pandemic threats and other health security issues. We also have issues with regards to access to medicines. We will talk later on how it is related to our strategy in the Horn of Africa and what we do in the Horn of Africa. We also have sustainable health and digitalization. In the determinants of health, as you know, there are other factors in the health care. So this justifies the multi-sectoral approach. There is a governance aspect and addiction policy in the Swiss health foreign policy. There is also another framework under progress, which we call SDC Health Strategic Orientations. So it's a strategic an institutional framework to guide SDC's engagement in the countries of operation. Coming to our country strategy in the Horn of Africa, in the Swiss cooperation of strategy in the Horn of Africa, the currently running strategy, we have 4 domains. Out of the 4 domains, health is one of the domains that we are working on. And as an objective in the health domain, we have an objective of addressing the needs of the most vulnerable population and enabling them for improved access to affordable and good quality health care. In the strategy, in the international cooperation strategy that I mentioned earlier, health is not an explicit objective. As we mentioned earlier in different platforms, health is not an explicit objective, but we have it in other objectives. So there is an overall goal of poverty reduction, reduction of inequalities, and sustainable development, and 4 key strategic objectives. If we try to map up where health fits, it fits in the saving lives agenda, it fits in the providing quality basic services, which includes health. These are the main areas. But thinking of One Health, if we ask where One Health fits in, it's beyond these 2 elements. So we see when we work on the pandemic threats, we talk to saving lives agenda, and especially the design of HEAL is more on the service delivery. When we talk about service delivery, we contribute to the objective of providing basic services. When we talk about the environment aspect of One Health, we indirectly address the climate change and its effect. And we have an NRM component, as you know, so it also contributes to the sustainable management and use of natural resources. So One Health goes beyond just one component of the objectives. So when we see why we choose to invest on One Health in the Horn of Africa region, I'd like to start from our strategic focus in the Horn of Africa region. As you can see from the map, the focus areas for the international cooperation team of SDC, it is the Somali part of all these 3 countries, especially the lowlands. So it covers the whole Somalia, It covers the Somali region of Ethiopia and the lowlands in other parts of Ethiopia, in Oromia, and also the northern Kenya. So this is our strategic focus. And as we all know, this Horn of Africa region is challenged by cyclic droughts. You can see from the dried up river on the picture, and how it affects, we all know how it affects the lives and livelihoods of people in the lowlands of the Horn of Africa, and also the health of humans. We also know that there is an issue on the access to veterinarian care and issue on the access to healthcare services. So this justifies why we are interested to invest on One Health. So there is a standard definition of One Health, as we all know. As Swiss health partners, there is an agreed upon definition of One Health, which states any added value in terms of better health and well-being for humans and animals, and financial savings and improved environmental services. As you know, when we talk about One Health, what directly comes into our minds are zoonotic diseases. So it's really driven by these diseases which are of international concern. However, our health partners agreed that One Health goes all beyond those discussions. So it is about the well-being, and it's about the livelihoods of the communities that we serve. So when we summarize why we are investing on One Health, one, as I mentioned earlier, it's in line with our strategic frameworks. In the health programs in the Horn of Africa, we have 4 major pillars. We have maternal and child health, we have sexual and gender-based violence, we have private sector engagement, and One Health is another pillar. So it's one of our major pillars in the Horn of Africa. And also studies show, there are different studies which indicate that it is economically efficient to address those health and livelihood issues in the pastoralist areas if the different sectors come together. There is always a gain, an economical gain, when the two, in the transdisciplinary and multidisciplinary approach. So that's why we agreed upon that common definition of One Health. It's also evident that we are now being threatened by different zoonotic diseases of international concern. COVID-19 is a good example, and we all remember about the Ebola outbreak and the highly pathogenic avian influenza, just to mention as some of the examples. So it justifies why we come together. There is also a concept of value addition. There are different topics when that many donors invest when we talk about health sector. But in terms of One Health, there are limited number of donors investing on the One Health issue. So Switzerland is always looking at niche that we can capitalize on, and areas where other donors are not as such engaged. So One Health is one of them. We also have Swiss expertise in the HEAL project and also in the other project that we have. We can give an example of one of our famous institutions, Swiss Tropical Public Health Institute, which is hosted by the University of Basel with many expertise. And also we have a team of expertise in the veterinary Sans Frontières Switzerland. So we want to capitalize on that value addition. Going to the last point of our ongoing investment, we have the Jijiga One Health initiative, which started in 2015 and which we aim to finalize by 2016. So this is the first One Health initiative in the Horn of Africa, financed by Switzerland. It is more of a capacity building initiative. So the main aim of this initiative is establishing a center of excellence within Getachew University. It's a project implemented in consortium by Swiss Tropical Public Health Institute, Getachew University, and Armar Hansen Research Institute. So it is this project is more of a research type and more capacity building, and also has a policy element. HEAL is another project that we always mention as a bottom-up kind of One Health project. It started in 2019, as you all know, and the service delivery and livelihood element is one of the areas that we want to capitalize for the HEAL program. It's a regional project, as you know. The third initiative is driven by the COVID-19 issue. So we have COVID-19 responses in the Horn of Africa, in Ethiopia, in Kenya, and Somalia. We implement through different agencies like the World Health Organization, AMREF, through VSF Swiss, and through our Getachew One Health initiative. So these are, in summary, what we are doing in terms of One Health. I hereby hand over to my colleague Larissa to complement the areas that I covered. Thank you very much.
Thank you so much, Lensse. No, I think you have really pointed out, you know, how our how we set up our engagement in what framework, and what our thinking is behind supporting One Health approach in the Horn of Africa. So I don't think there is too much for me to add. I'm also aware there are other inputs. I don't want to take of their time. I just want to re-emphasize really, I mean, I'm new to the Horn of Africa program here in Ethiopia, where I just started a few months ago. But what I really started to understand, you know, this is really one good example of, as Lensse has said, Switzerland trying to find a niche. So basically something, you know, a very promising approach, but no one really is investing in it that much yet. So basically what we are usually trying as STC is finding something that we can pilot, or starting to create good practice together with our partners. And then we are hoping basically that others taking this up and yeah, we'll scale it up actually. So that's just one point I wanted to make. The other, Lensse mentioned we have 4 portfolios within our Horn of Africa program. And one of the others is actually food security. And there we see really strong links, of course, with what we are doing. We work, as mentioned, in the lowlands. And so we work with the agro-pastoralist communities. In our food security projects, we have a lot of natural resource management, ways of diversification of livelihoods, you know, and of course, the same questions as you're also addressing in HEAL are popping up, of course, in our food security portfolio. So we are looking really also to linking our engagement in this regard. So yeah, I think with that, I'll hand over back to Barbara. Thanks.
Yes. Thank you very much, Lensse. Thank you very much, Larissa. I think it's really useful to understand how the One Health work you're engaged in Ethiopia links to the overall SDC strategy and also to the Swiss health foreign policy. I thought that was really interesting and useful to see. In the interest of time, I think we're going to skip questions for now and do that at the once we have heard from all 3 funding agencies. So with this, I would like to invite Faben from the Italian Agency for Development and Cooperation. And I think Saba is going to share the screen for Faben.
Okay, I can also try if it works.
No, I think it's coming.
Okay.
Just give Saba a second. Sometimes takes a bit of a couple of seconds for Zoom. Saba, are you going to share the screen?
Yes, I'm sharing it.
Okay, it's coming. Okay, there we go.
Okay. Thank you so much. Good afternoon, everyone. It's good to meet you here. I'm Faben. I'm the national expert for nutrition and gender mainstreaming for AICS. I have here with me Gabriele Mugnai, who's our senior expert in drought resilience programs. So I'll be presenting AICS's perspective on investing in One Health. I'll try to briefly present why AICS invests in One Health, what investments are in place, and what we recommend to better coordinate investments among the different donors. So next slide, please, Sama. So why does AICS invest in One Health? We believe that the One Health approach is a comprehensive approach for pastoral communities to improve public health and economic growth outcomes. In fact, many public health as well as economic challenges at the human, animal, and environment crosspoints are inherently multisectoral and therefore require multisectoral and comprehensive solutions. On top of this, as the Ethiopian society is growing and transforming fast, there will be a growing demand for animal source foods, and therefore a possible growth of the livestock sector too. So that is expected to affect people's livelihoods, the environment, and the public health in general. Last but not least, there is also an interest on our part in enhancing the resilience of the pastoralist system by strengthening the pastoral livelihood system capacity to absorb and recover from disruptive shocks. This also through the promotion of economic models that are based on livestock value chains. So we're trying to address these interests on AICS side through different programs, health, nutrition, emergency, and drought resilience programs. Next slide. So when we come to the investments in place, we actually do not have one single program focusing only on One Health. Our approach is incorporating One Health in most of our programs in pastoral areas. So we have a series of emergency, what we call them progetti di emergenza, which is can be translated into emergency programs, which have a duration of maximum 2 years, with significant One Health components. And these are implemented by Italian NGOs through different funding mechanisms and channels. We also have now AICS is soon to launch a regional program with WHO. The main objective of this program is facilitating health and nutrition access to populations in hard to reach areas across the borders. These are mostly pastoralist areas. The project will focus on Ethiopia, Eritrea, and Somalia. And with this project, we can say that the main interest is expanding the knowledge of the pastoralist context so that actually they can have better access to basic services, that is health, wash, nutrition, and so on. I would like to particularly mention and give emphasis to our currently ongoing resilience program in Afar, which is implemented by the government of Ethiopia, and which has the objective of enhancing drought resilience and improve sustainable livelihoods of the pastoral as well as the agro-pastoral communities in some woredas of the Afar region by using a holistic approach. So this project is actually based on 2 pillars. The first pillar next slide, please. So the first pillar focuses, let's say, on ensuring structural economic growth. And the second one is on climate change. Next slide, please. Yeah. So these pillars will be implemented having the environmental, human, and livestock health at the core of the approach. So we believe that this is quite an innovative approach of viewing the human, animal, and environment interface to ensure public health safety, agricultural production, ecosystem services, like ranging from food and nutrition security to disaster resilience, as well as economic benefits. Next slide, please. So coming to what donors should do in terms of coordination in investments in One Health programs, we believe that the share of information on the results of studies and researches is very important. Especially, I mean, on the slide, we have like 3 major points that we think are quite important to share information on. That is the pastoral mobility routes, the land tenure issues and overlapping conflicts, and then conflict hotspots and so on. We believe that it's quite important to be able to share information to this regard. The other thing is donors should also, acting especially in the same areas, should be able to find synergies in with their programs. And then also, if possible, being able also to design programs. Let's say it can be either joint or even if it's separate, programs can be designed in a way that we can have synergies. The other thing that it's important in our opinion is also being able to have a public debate on how to rebuild, let's say, dignity in pastoralism. Because pastoralism can also be one of the most environmentally sustainable, economically profitable, and strategic ways of life for the Ethiopian economy. Last slide, please. And as the last point, we can raise as a recommendation a discussion, let's say, among donors for feasible strategies to incorporate priorities and the values of pastoral communities in order to sustain their pastoral livelihoods. So this is from our side. Maybe if Gabriele would like to add some points.
Thank you, Faben, for the comprehensive presentation. Just to add something, very few words on the need to rediscover the in terms of debate and idea sharing among us, and also with local counterparts, the extremely high potential of pastoral areas in terms of livelihood, value addition, and livestock value chains. So this is the reason why during the implementation of the drought resilience project in Afara, we are actually investing much in energy access. That is something extremely required to allow the improve the enhancement of milk and small ruminants meat value chain. That is actually something extremely strategic in terms of revenues for pastoral communities, but also in terms of decreasing the pressure of livestock and herds on the grazing land, in the sense that the commodification or the vision of pastoralist on the livelihood, on the livestock, that becomes a bit more commodity, a bit less asset, could also decrease the in the perspective of 5-10 years, could decrease a bit the pressure of the herds on the grazing land. That's why we are working on this access to energy through off-grid renewable energy solution. Thank you.
Okay, thank you very much, Faben. Thank you, Gabriele, for these inputs. I think very strong plaidoyer for pastoralism. So with this, I would like to move on to our next speakers, and I would like to invite Björn to present or give us an introduction to BMZ's take on One Health and what activities, investments BMZ has been taken in the last few years. Björn, over to you. I think you might have to unmute your microphone.
Is unmuted.
Yes. Okay, now we can hear you. Please go ahead.
So good morning, good afternoon, good evening. Björn Niere is my name. I work as a senior policy advisor for the BMZ, and I don't have a presentation, but I want to give you a short overview of where we come from, what we have done so far, and what we are planning to do next. So where we come from is we started considering One Health in projects in agriculture in the special initiative One World, No Hunger. This is one of our flagship programs. It's a special initiative initiated in 2014. We have a budget in this special initiative of roughly €500 million, and maybe you're familiar with the Green Innovation Centers. This is one of the flagship programs within the special initiative One World, No Hunger. What we realized is that we don't have really a focus on livestock. Also, livestock is tremendously important, and of course everyone at ILRI probably knows how bad funding is for livestock, and so we decided that we need to increase our support for livestock and livestock systems, and this is where we started. And we started with a climate change focus with ILRI and the World Bank, and this is the program on climate smart livestock systems. And then we further developed this together with ILRI, and we initiated the BUILD program. And the BUILD program, I'm sure some of you at least are familiar with BUILD, boosting Uganda's investment in livestock development, has several pillars, and this is basically the structure that, and it shows the BMZ way of thinking. The structure is, it consists of BUILD focuses on one classical animal disease, that's PPR, but also we have a pillar here on zoonotic diseases in BUILD. It's Rift Valley fever. There's a pillar on AMR and on veterinary public health, or food safety, if you wish. So this is basically our way of thinking. So one project shows what we think is important. We think that agriculture, environment, of course, is, everything is interconnected, and we need to embrace this complexity, and that's why we then initiated last year ORECA, the One Health Center, which was opened on 22nd of October. And we are very pleased that ILRI has taken the lead on ORECA, and this is the first project that carried the name One Health in the BMZ, at least as far as we know. At least not so prominently. We don't have any other project that features more prominently than ORECA. And so this was basically where we come from, and it is important to know that, as I mentioned, livestock, or interest in livestock within the BMZ was not so very strong, but of course, when SARS-CoV-2 arrived on the scene, then this has changed enormously. And now suddenly everyone talks about One Health. And when they talk about One Health within the BMZ and within the GIZ and KFW, the implementing agencies, then it has very often a wildlife focus. Now biodiversity and human health, animal health is now very much linked, and again it is very hard for us to bring back One Health. To target the whole complexity and the whole spectrum of what One Health is. One Health is not only the wildlife, human, animal, or environmental interface. It has also to do with animal husbandry. It has to do with food safety and so on. So we need to bring this back. And what we have done now, since the Corona pandemic or COVID-19 pandemic, we have initiated a new directorate, Global Health, One Health, Pandemic Prevention, and we've created a new division. This is the division where I work in. It is on pandemic prevention, One Health, animal health, and biodiversity. Here again, you see that the whole complexity is now squeezed into one division. We have created an advisory board that advises the BMZ on strategic, basically on strategic positions. And this advisory board is composed of human health experts, animal health experts, and environmental experts. And we are quite pleased. So we are now, this advisory board has come together. We have now the new structure. We have, since this week, we have 2 new colleagues working on One Health, one with a background on human health, one with a background on animal health. So we are a much stronger team, and we have endorsed, it's basically endorsed a strategy on One Health, and this is where we want to go. And here we have 4 pillars, or 4 components we would like to achieve. First of all is mainstreaming. We need to integrate the One Health approach in all our BMZ portfolio, wherever it is relevant, of course. Then we want to strengthen cooperation and capacity development, and also we need to, or we want to contribute that, to agenda setting. One Health needs to be more prominently featured in international policies. And for instance, one of the approaches that we are doing or that we are pursuing together with other countries and also, here in collaboration with the German government, with our fellow ministries, we like to support the tripartite and also the related activities. So this is in short what we are doing. And then Barbara, you asked about our current investments.
Yes.
I mentioned ILRI is I would say our first partner. ILRI was there from the beginning. I started with the PCSL, the Climate Smart Livestock Systems, and we moved on to build, and we've moved on to Oreca. So ILRI is our main partner in the field of animal and One Health, and I think ILRI has done a great job. Also, we actually, this kind of cooperation that ILRI is working together with KEMRI and so on, this is great. This is what we'd like to support. We've also, maybe you've seen the press release, at least some have seen the press release, together with the World Bank. We are investing in the newly established multi-donor trust fund Food Systems 2030. And within this trust fund, it doesn't carry the name One Health in it, but we've made sure that this is a One Health a trust fund, basically, in the field of agriculture and food systems. So these are our main investments. We've also started a project on food safety together with the BFR, the Federal Agency for Risk Assessment in Germany, that will be implemented in Tunisia. And then, of course, we have also initiated several projects which deal with trade of wild animals or wild animal products to reduce the risk of zoonotic spillover events. And here we would like to see a strong collaboration also not only in Africa, but also in Asia. And we have, and this is something that I should mention because we are working on this in our division. I mentioned that our division also carries the name pandemic preparedness or pandemic prevention. We have a rapid response team, the schnell einsetzbare Expertengruppe SEEG, SEEG, and this is also now will be, it used to be composed of mainly human health experts. For instance, it was initiated for the Ebola outbreak, 2014-15, and it will now be enlarged by experts from the field of animal health from the Friedrich Loeffler Institute. So here we also try to broaden the focus from a human health perspective to a One Health perspective. And I think what is important is that we are trying to make people understand, and here this is why mainstreaming is so important, because we need to start this in our ministry. We need to show how complex, and everything is connected. Everyone knows that, at least I'm sure in this webinar everyone knows that. But you should not take this for granted. Not everyone knows that. People think you can have simple solutions for even huge problems, but nothing is linear, nothing is straightforward. So I think our team here in our division, we have understood that we need to embrace the complexity. And with that, I would like to end, but I'm very happy to answer questions, but I think this will follow now. Huh?
Thank you so much, Björn. I think another sort of strong message in favor of One Health, and I think it's great to see how the different funding agencies sort of are embracing One Health more and more. And so I just would like to follow up with the speakers on that. So we see there is a lot of new investments, new ideas coming. So I think for us as representing the development and research community, I think for us it would also be interesting to know, so how much are the donor agencies coordinating what they plan to do? Because we have seen, for example, with the investments from SDC, that SDC realizes One Health requires a long-term commitment. So that also means possibly quite funding over a long time, because One Health is complex. If we want to change the structures, if we want to change the institutional setup, it takes time, and it needs sort of this constant engagement with the different stakeholders. So, and then often it could be maybe too much for one funding agency. So what mechanisms do the three of you, so AICS, SDC and BMZ, have to interact with each other? Is that something you embrace, or you would rather invest more from your country? So what mechanisms do you see there, and how as a development and research community can we support you in this? Maybe we start with SDC, because you were sort of quite strong in trying to pull different funding agencies together. Larissa or Lensse, can you comment on that? How are you trying to collaborate with, or sort of engage with other funding agencies?
Okay.
Lensse, I give you the floor, since you've been involved since quite a while. I think you have more to share on this. Please.
Okay. Thank you, Larissa. I can just throw ideas on potential areas. In the past, we have used the platforms which are existing in terms of One Health to coordinate and look for synergies with other donors and development partners. An example is the National One Health Steering Committee. They have a yearly exercise of doing this action plan, the National One Health Action Plan. Apart from the main action plan that the government partners, the different sectors or ministerial offices pull together in terms of One Health, they also invite development partners to share their plans to make sure that One Health activities are harmonized. So these are the some of the platforms that we see to know what the other development partner is doing and to seek synergies. Saying this, I think it will be a very good idea going forward to look for areas to collaborate further in terms of exchanging information, sharing. Faben was earlier mentioning about the need for sharing data, sharing the research outputs with the other development partners. So I would like to also second that idea. So sharing, exchanging, and looking for platforms to exchange will be a great idea to work on. Thank you, and over.
Okay, thank you very much, Lensse. So that's mainly also what you're trying to do at sort of regional and national level. Are there also more at the headquarter levels efforts for interaction with other funding agencies, or is that something that is purely done at sort of country, regional office level?
Maybe I can also give the example of the annual forums which are organized at headquarter level. For example, there is a Geneva Health Forum upcoming. So these kinds of forums will be, in my opinion, will be a good platform
Okay.
But for this, I give the floor to Larissa because, yeah, my limited engagement at that level since I joined SDC very recently.
Yeah, no, that's okay.
Yeah.
I don't know, Larissa, do you want to comment on this or yeah?
Yes, sure. Quickly, I mean, what I can say is in SDC, we're really following this principle of decentralization. So, you know, let's say the important decisions regarding programming, even strategy in the countries that we are engaging are really made locally in our offices here. And for One Health specifically, it's not something that we are having some specific engagement also going on at HQ level. It's really something driven from our Horn of Africa program. So as of now, I think, yeah, it's mainly at this level. But as Lensse has mentioned, there are quite a few opportunities in regards to the broader health discussions at HQ level where we can tap into.
Okay, great. And maybe moving over to our colleagues from AICS. So what would you expect from the development and research community also to strengthen this interaction between funding agencies? So you did mention about sharing of data, but in sort of what form would you expect us to do that? What would be helpful for you as a funding agency? I don't know if Gabriele or Faben would want to comment on this.
Yeah, thank you. Yeah, right now we have coordination with other donors in the framework of IGAD, the Intergovernmental Authority for Development, because our project in Afar is implemented as one of the program under IGAD umbrella. So we have coordination during the steering committee of IGAD, and at local level we are coordinating in the Afar regional state, especially with our colleague of GIZ that are implementing similar intervention in the region. And we are relying on IRRI for sure. At the beginning of the project was our main partner in developing the baseline of the project. And we are working also with research center at local level. So we are working on with Semera University, especially for the analysis of livestock mobility routes, for the conflict hotspot assessment in the region. And we are trying to share as much as possible this information through GIS-based database, let's say geodatabase that has been uploaded on a Dropbox, and gradually we are opening it to all the stakeholders that are interested to be engaged. A kind of solution like this is quite simple, I may say, quite naive, but can somehow solve the problem of data sharing and information sharing, especially from area where the data from the field are very poor and scattered. So in order to know to have a basic knowledge on how to plan intervention and program, is very important to have a common knowledge on this. So this is why we are actually trying to do it and gradually to build the information starting from a far regional state, but we are also interested in all the arid and semi-arid land of Ethiopia in order to have a common vision on it, because it seems wide, but it's not so simple to have a scientific knowledge-based understanding of on how the people move, how the herds move, and where they spend most part of the year in search of grazing, water, and so on. So this is basically our idea.
Okay, great. Thank you for clarifying that. Björn, I don't know if you want to add anything to that, because you also mentioned before on how you try to interact with other initiatives and how to coordinate. Is there anything you would like to add to that?
Yes, I would like. Thank you very much, Barbara. Okay. For us, we are, as I mentioned, we are only starting. So first of all, Oreca to me, would sound like a very good platform at a regional scale. And I understand that regions may be differently interpreted. Some may consider the whole African continent as a region, and some may think it's East Africa. But whatever the case, Horeca, I think, could be in a role, or it could be strengthened in such a way that it is the platform and it is the central hub for everyone coordinating One Health in the region. That's number one. Number two is we are in bilaterals with other member states of the EU, but also at EU level for development cooperation. The One Health is at least it is put on the agenda, and people start to understand what One Health is. And this is something I would say it's still a baby, but it can be nurtured and it can grow. So I think it is good that we interact. And one last thing, I think what could be very helpful and what we have done in agroecology, which is also a very holistic concept of agriculture, of food systems, if you wish. Agroecology, we have created a donor group on agroecology, and we have met here in Berlin in February, and something like this could be very helpful also for donors to interact in such a format. So this is another suggestion, but yeah, that's it for the moment. Thank you.
Okay. Yeah, thank you very much. I think that was also something that possibly could be looked at in more detail in the future, because I think that that's a good way to then also coordinate or align the different One Health initiatives across funding agencies and countries. And actually, I saw the message from Lensse, who also sort of thought that formats like this community of practice can be useful. So I think we want to continue with that, and maybe in 1 year's time, again, get some input from funding agencies for that. And I have also seen a question from Dieter on the chat, and that was going to SDC, asking for a little bit more information about the COVID-19 actions, interventions taking place. I don't know, Lensse, do you want to give a very brief update on this, on what you are doing there?
Okay, yeah, thank you. Just briefly, we, through WHO, Ethiopia and WHO Somalia, we supported the preparedness and response activities in COVID-19 in Ethiopia. We focused in the Somali region of Ethiopia, five zones of Somali region. We also supported secondment of epidemiologists to WHO in Ethiopia. We also supported laboratory. One is the COVID-19 lab in Jijiga through Jijiga One Health Lab. So this is currently up to now the only laboratory being used in most of the Somali region. Through VSF, we also supported COVID-19 laboratory in Yabello. There are also other activities in Kenya. For example, through the need identified through the Ministry of Health, we supported procured isolation stretchers. There is also an activity conducted in refugee camps two refugee camps in Wajer County through MSF Switzerland. Just as a snapshot, this is the summary. Yeah, thank you.
Okay, thank you for this clarification, Lensse. And I just saw a comment also from Mohan, and that's maybe something for colleagues from AICS, that it is about nutrition and One Health, and to what extent One Health investments improve or look at improving availability, accessibility, and consumption of nutritious food. So maybe Faben,
Yeah.
can you comment on that, on how you address this? Because you mentioned resilience actually also as an important sort of development outcome of One Health interventions.
Yeah, so I can mention, let's say it's not finalized yet, but it can be a good example of how this can work. So there is, for example, a plan, let's say, because our resilience program, one of the components is, of course, the energy part. With the energy part, we will be providing energy for cold rooms to, say, store and transport livestock products, say even meat or milk and so on. So for example, now we are exploring opportunities with other implementers in the area and also other donors to work, for example, for including these products into school feeding programs. So this can be like a very simple example of how these two can work in synergy.
Okay, great. Thank you for these additions. I can't see any other urgent questions coming up. So, and time is up. So we would like to conclude this webinar for today and thank all the speakers